Okay, we will go ahead and get started. It is 2 o'clock. I want to thank everyone for attending today. This is a different take on BIM Group's Tuesday Talks, but I'm really excited to uh, have Jay and Beverly here with us today. We'll talk about those folks in just a moment, but just a couple of housekeeping items. One, if you're attending, please be sure to mute your microphone. You do not have to show your face on camera unless you want to. If you have questions as we go through, please enter those in the chat box. You'll see that on the far right bottom, and we will address questions at the end. We'll try to get to as many as we can, either as a total theme or exact questions, however that may be. And then we're going to have a great resource document that will be sent out to all participants after the webinar. So let me welcome you to our Healthy at Work Phase 1 reopening, what this means for your business. And I'm Deanna Sizemore, Director of Compliance with BIM Group, and we have Beverly Clemens, President of CMI Human Resources Consulting, as well as Jay Engel with Jackson Kelly. A little bit about our presenters is Beverly has more than 20 years experience in human resource consulting. She specializes in talent acquisition and development, recruiting, engagement surveys, behavioral assessments, hourly and salary compensation design and analysis, wage and benefits administration, outplacement and career transition services, and general human resources consulting. She has worked with many companies and clients in various industries, including manufacturing, nonprofit, financial institutions, healthcare providers, internet-related companies, and many others. Beverly, thank you for being with us today and sharing um, next steps for reopening Healthy at Work in Kentucky. We also have Jay Engel, who's an attorney with Jackson and Kelly PLLC. He is a member of the Jackson Kelly firm in Lexington, Kentucky, where his practice area includes business law and civil litigation with a focus on commercial litigation, employment law, equine law, and health law. He also advises clients on various governmental, legislative, and regulatory matters and serves on Commerce Lexington's Public Policy Council. So Jay, thank you as well for being with us today. If you've been a part of BIM Group's Tuesday Talks over the past few weeks, we've talked a lot about COVID-19, which is at the top of everyone's radar. So with that, we wanted to start talking about Healthy at Work and what that means to reopen and what that looks like for our businesses and different industries throughout Kentucky. So just a quick kind of recap of where we are. We did have businesses start reopening on May 11th. That was mostly manufacturing, construction, vehicle dealerships, office-based businesses at a reduced capacity, horse racing with no fans, pet care, grooming and boarding, and photography. Reopening May 18th was government offices and agencies. Coming May 20th is retail in a reduced capacity, funeral homes, and side note, houses of worship was originally set to open on May 20th, but that was moved up to May 9th. May 22nd, we have restaurants at 33% capacity and outdoor seating with 10 partial social gatherings that can resume. May 25th, we're going to see a reopening of acupuncturists, hair salons, barbershops, massage therapy, nail salons, tanning salons, and tattoo parlors. June 1st will be movie theaters and fitness centers. June 11th, campgrounds. June 15th, some childcare, again with limited capacity, youth sports, low touch and outdoors. And then July 1st, we can see bars and groups of 50 or more people. So Jay and Beverly, I'm going to let you take off and go from here and tell us a little bit about what we need to know. I think, Jay, you were going to go first, so I'm going to leave this one slide up, if that's okay, and let you talk and go from there.
Yeah, thanks, Deanna, and thanks for inviting me to join. And I think we actually have a slide that might have some of those dates you just read, if anybody wants to look at those while I get us started. You know, Deanna kind of gave us a heads up in this slide, which gets updated daily. I think some more definitive guidelines even came out last night for hair salons and tattoo parlors. But this is always a good resource going to the state Healthy at Work site. But this kind of tells you when you can reopen. But one of the things we want to talk about is when you should reopen. And one of the big questions we get is, what are the risks? And there are probably, overall, there are two risks. There's the legal risks, which I'm going to talk about for just a second. And then there's also just the business and operational risks that Beverly will talk a little bit about. Are you ready from a business standpoint? Are your employees ready? Are your customers ready? But for legal risks, what happens if I open and I'm not ready? There are kind of two big categories that I see. One is related to exposure. What happens if I open up and somebody contracts COVID-19? And in those types, there are again two. You could have employees that get exposed and contract COVID-19. That's the lawsuit. I think the first one that got national attention was against Walmart up around Chicago. A Walmart employee contracted COVID-19. A lawsuit was filed. Unfortunately, the employee died. And the allegations were that Walmart, wasn't following guidelines, didn't have a plan in place, was reckless in continuing to operate, and is responsible for that employee's death. The other type that you could see related to exposure is by customers. If you are a business that has customers regularly and a customer comes in and contracts COVID-19, are you going to be liable somehow? So those are the two types related to exposure. The other ones that you need to be real careful about are related to employment issues. Your employees, the leave policies. I'm sure you've studied the paid leave under FFCRA, the EFMLA. You're going to have to watch for some timekeeping and wage claims. Discrimination bias is still out there and has some catchy spots we'll talk about. ADA claims, all of those can get implicated as you reopen your workplace. So we'll have claims related to exposure, claims related to more employment law, employee issues. We're going to talk more about exposure and how you reopen safely in that regard today. And any claims related to those are going to be judged largely by kind of a reasonableness standard. Did you take reasonable steps to get ready? Did you follow government recommendations? Are you acting as other businesses like you are acting? Are you following industry or trade association guidance? What are other businesses like yours doing? What did you do to get ready? Do you have a plan? How did you develop it? What did you rely on? Did you use resources? Did you call your cousin who happens to be a nurse who gave you a few suggestions? Does it match your workplace? There's obviously tons of resources on the internet now. But if you just pick one that you find on the internet, but it doesn't really match your business, that can get you in as much trouble as it does help you. And then once you have a plan, did you train your employees? Did you communicate it? How did you implement it? How did you follow it? Those types of things are what you're going to be judged by for any legal risks. Now, to be ready to open, there's also business implications with your workforce and your customer base. I'm going to let Beverly talk a bit about those now.
Thank you, Jay. And good afternoon, everyone. Happy to be with you today. So yes, there are other risks as you think about it for your business, certainly your reputation. I was just on the phone this morning with a small client who has a few folks that have tested positive very recently, and one of the employees' fiancés posted on social media, and it was pretty derogatory toward the company, even though the company has been taking the effective steps. So some of the risks that you need to think about for your organization are, your reputation and being able to keep your employees, maintain your top talent, and attract top talent. In addition to, again, displaying that you are a safe place for your employees to come back to work to. So with that, I'm going to move in and just talk a little bit about how do we get ready to reopen. And so I think first we have to take a look at all the aspects of your business, which I know many of you are doing, have been doing, and some of you have been continuing to operate in some capacity. But what does this new normal look like as it relates to the operations, for example? Determine any high-level changes that will need to be communicated to employees to help them adjust and adapt. It's going to be a very different world for them coming back if they've been at home, laid off perhaps, or even some of those that have been teleworking, and the difficult changes that you'll need to make in the workplace. Part of that is assimilating them back and making them feel comfortable. So what will the workplace look like? It's going to look very different when you have to adhere to the minimum requirements that the governor has outlined. What will the day-to-day look like in your operations? What's changed? What's new? What are the drastic changes? And again, you'll hear Jay and I talk a lot about communicating and planning, because that's what we're having to do. But communicating all of these changes is vitally important. What will continue virtually that you hadn't thought of before, that now we're having to really look at all of our interactions that were people-driven, in person, face-to-face? How do you modify and make those changes? A big component of looking at how do you get ready to reopen, of course, as you've looked at these minimum requirements and the 10 rules and the CDC website, are health and safety. And we'll talk about the designation of a healthy at work officer. Again, this is a requirement. It's not a suggestion. It is a requirement. You'll want to conduct a hazard assessment. Really, really look at your environment from multiple angles and sets of eyes and perspectives to see where could someone, or where is someone most likely maybe to be exposed to COVID, where and how do you mitigate that risk? You'll need to develop the COVID-19 screening, testing, and reporting processes. And again, we're going to go into depth on those here in a little bit. Of course, we all know we're required to order and maintain adequate PPE for our workers to ensure that they have everything that they need based upon your environment, your industry, your requirements. And then, again, how will you reassure your employees that it's safe to come back? That's the biggest concern that we're hearing. Is it safe? Am I going to get sick? I'm so afraid I'll get sick. So again, it's down to communicate, communicate, communicate. You'll also want to look at your staffing and productivity. Obviously, some of us will not bring back all of the employees that we had. We will not have the same head count. We're going to be evaluating the productivity levels of the folks who have been working from home. Did they excel? There are some people that have absolutely just thrived working from home. One self-described introvert said, I absolutely love it. I don't have to chit-chat and people aren't stopping in my door to talk and interrupt me. So some people work really well from home. Some people don't work well from home, and the productivity really slips. So how do you evaluate those as far as which positions need to be in the office? And again, what level can they continue working from home, and how do you increase that productivity? And then what about employees who say, I'm not going to be able to return due to caring for a child? We're still seeing the guidance released around day camps and summer camps and schools and daycares. And so we've got to be very, very flexible with our leave policies and understanding. And then, of course, taking into account, like Jay said, the emergency paid sick leave and the emergency FMLA. And then there's going to be a lot of training required. Your managers and leaders are going to need training with how to manage remote workforces and also how to manage the people coming back in the workforce. It's just going to be different for a while. There's going to need to be more encouraging and supporting and managing emotions, in addition to now trying to get back to the business of business. Your whole organization may need some change management. So all of this, if you keep all of this in mind based upon the 10 rules for reopening, and again, the minimum requirements, that will help you put your plan together. And Jay will talk a little bit more about what should go into your plan.
Yeah, so I think everybody realizes you need a plan. And, when you're ready to reopen is after you have your plan in place. And how do you draft it? The good news is there's lots of resources out there. There's the minimum requirements we're going to talk about in a minute from the state, but those are largely based on the White House Guide to Reopening. CDC has put out a lot of good material on their website. OSHA has some guidance locally. The Commerce Lexington has a real good resource page and a guide to reopening handbook they've just released. And we've got a lot of these resources on a handout we'll follow up with everybody with links to them. So that's going to be your best bet. And I think when you read through some of those resources, if you haven't already, you'll see some common themes. But probably the number one place to start for a Kentucky business is going to be going through the minimum requirements that the governor has issued. And what you see on the screen here is the URL for the Healthy at Work website there at the top and a screenshot. And then when you go to it and scroll down a little, you'll see where the red arrow is, the minimum requirements. And you're going to want to click on that because it lists the 14 requirements and then now has some guidance added to the end of it. And another theme you'll hear is things are constantly changing. So you're going to want to go back to it, because I even noticed as I was reading it yesterday to help get ready for today, I saw some things that were different than when it first came out. And those aren't always announced as big changes. So keep up with it, go back to those minimum requirements. But then there are also industry specific requirements. And if you scroll down on the website, and I think we show it on the next slide, there are also, for each industry that's been cleared, there's a link to click on. Here you can see the places of worship was first, then construction, horse racing, manufacturing. Each of those will have some additional requirements. So you want to go to both of those on the Healthy at Work website as your starting point to really give you guidance. So what we thought we'd do today is go through the 14 points in the Kentucky minimum requirements. This is what it looks like when you click on that link at the start, and then as you scroll through, they're in numerical order. We've kind of regrouped them a little. Not all of them follow sequentially. I think you can group them. So the first one we're going to do is kind of what to talk about in bringing your workforce back. And Beverly's going to talk about the first two items in that list right here.
Thank you, Jay. So yes, let's talk about teleworking. So many of us were forced to make this work, right? Figure it out, get some people set up so they could work from home very quickly. So now is the time that we need to take this step, take some time, pause a bit, and look at our policies. What is in your handbook? What sort of a teleworking policy do you have? Does it need to be updated or enhanced, or do you need to develop it? So we not only need policies, we need processes, we need procedures, and we need agreements with our employees. You need to look at and consider the safety and liability issues. One of the things that some folks may not be aware of is, of course, your remote employees are going to be covered by workers' comp also. They're going to be subject to all of the normal employee laws and regulations that would apply if they were in the workplace. So what does this look like? And then, of course, as many of us have struggled to identify the equipment and the data and digital security, again, now's the time to put a policy in place. What will you provide? What is required in order for someone to be able to work from home? What will they need long term? What is the cost, the privacy? What about security issues, hardware and software requirements? All of these are important to consider. Some employers are going to maybe adopt the same BYOD, bring your own device policy if someone works from home that they had in the office. But again, what does that look like? And putting that on paper and getting the employee's agreement to all of that. Because also you want to look at how you get your property returned at the end of employment, which we're seeing some companies that are struggling with that right now because they didn't have good policies in place. And then for the employee, it's setting expectations. You know, what will their day look like? Are their hours, are they able to flex their hours around childcare? Especially, we need to look at non-exempt folks, right? And I don't know if some of you that have been teleworking have faced this with people who are working overtime because they're non-exempt and they have to track all of their time. How do you manage that? How are you going to communicate? Are you going to use Teams or some sort of instant messaging and a good calendaring system so that if people are setting aside time to work on a project and don't want to be interrupted, what does that say on the calendar? In some small companies, it's been really interesting just trying to figure out, okay, how do I know when I can reach out to someone? How do I know when they're available? When do they have to be available? How long or how much time do we allow them to respond to an email or a Teams message or a phone call even? So setting some parameters around that even and making sure that everyone is on the same page will be very, very helpful moving forward. Goals and alignment. How are we going to manage performance, and how have we been managing performance? It's going to be very different maybe with working remotely. How will we keep some employees engaged and motivated? And then how do you provide that ongoing coaching and feedback when you're not passing in the hallway or maybe even, you know, going to grab coffee or whatever you did previously, and now people are working from home? And then again, I go back to training. Again, your managers are going to need some training on this, but also, you know, it's been really interesting sitting on so many virtual calls, as I'm sure all of you have been, and seeing the etiquette. And so maybe some training around and some parameters around what you want your policies to be around that virtual meeting etiquette. And some folks are going to need training on the new platforms. You know, they may have used one of these, and gosh, how many are there? You know, we know all the big ones, Zoom and Skype and GoToMeeting and these types of things, but there's all sorts of new ones coming onto the field as well. And how do you help your employees get up to speed on that? And then number 2, the phased return to work. As you can see here, it's talking about, again, the generous policies and those types of things. And there are many factors to consider as you design your return to work strategy. Of course, keeping in mind as you bring people back into the workplace, safety is paramount. And many of us who are in you know, the service or business industry may not have had a lot of safety parameters to guide us before, but now we're all going to have these. And OSHA is being very aggressive. We've heard from 4 companies in the last 2 to 3 weeks that OSHA has been on site, and it's usually due to a concerned employee calling in with a concern. And again, OSHA's been very aggressive. While they talk about, you know, good faith efforts and being collaborative, they haven't quite been displaying that in most cases. So you want to make sure that everything you're doing, and like Jay said, that you're not putting your business at risk by opening too soon and not having a good plan in place. So what does your reopening strategy look like? Of course, we've got to determine the dates that employees will be brought back, whether that's telecommuting, or into the workplace, and will that be done in stages or staggered? And then develop a protocol for identifying who will be brought back when. You'll need to analyze your workforce needs. Which positions are critical to the business? Some of us, again, may have you know, been seeing that we might not have the same number of positions or the same head count coming back even long term. So one important thing to do also is with kind of succession planning, but thinking about this added wrinkle of if someone gets sick in our organization, who can take on pieces of that role, especially if it's a critical role. Who can take on pieces? Who is trained? So cross-training. Again, just in case someone is sick and unable to work. It's not that maybe they're just, you know, they have some symptoms and they need to be quarantined. If they're unable to work and it's a key role, how will you manage that? evaluate which jobs may no longer be needed. But of course, remember, as you're going through this process, as with anything, you want to use objective criteria, looking at the skill set, the education, and or tenure, of course. You may want to consider offering vulnerable workers duties that minimize their contact with others, but we've been cautioned by the EEO to be very careful about how we do that. Some of us may have a protective nature of wanting to protect someone we know in our environment who is vulnerable or a high risk. But again, this needs to be an interactive process, and it should not be a decision that you make to say, I want to protect you, so I'm not calling you back yet. Certainly you can ask some questions and go that route, or again, consider offering them a position or some modified duties during this time that reduce their exposure. And then what if someone doesn't want to come back to the work environment and they prefer to telework or telecommute? Are you going to allow them to do that? Is it on a case-by-case basis? How do you make those decisions? And then again, keeping the ADA considerations in mind. If someone now requests an accommodation to work from home, I think we'll see an increase in these. And I think it's something that a lot of us haven't dealt with in the past. We've said, oh no, all of our positions are required to work in the office. Well, we're going to be forced to look at that, I think. And then what if someone just refuses to return your call to work, especially in manufacturing and restaurants? We're hearing this, that employees are not responding to the return to call to come back to work. You definitely want to make sure that you notify unemployment. There is, as most of you probably are aware, there's a great little COVID-19 handbook that unemployment put out, and they do have some resources available. Some of them are not working still, kind of like the system is still a bit broken, but there is a refusal to work form there, and I think it's in the list of links that we'll be sending out to you after this. It leads you right to the form that you complete and send in. I would say complete it electronically, and then I would even suggest that you take screenshots and fax it in just to make sure it gets into the right people as soon as possible. And then you need to decide whether or not you're going to have everyone tested before they come back to the workplace. Some companies are doing that, and certainly you can during this time, again, under certain parameters. And then develop your health and temperature screening strategy. We'll talk a lot more about this later on as it relates, again, to identifying that healthy at work officer. And then you want to plan the communication strategy to your employees. Communicate the return to work plan and timeline as early to them as you can and in as many methods as you can. You want to reach out, mail, text, email, social media, whatever works for you, but definitely mail, email, phone. Make sure you send it with proof of delivery in the mail so that you can prove that they received it. And then depending on your group, you may want to consider setting up just a few town halls or virtual meetings with small groups or large groups just to have some encouraging conversations before everyone comes back into the office, and maybe talk about some of the big changes that they're going to be experiencing and again, how you're going to help them adapt to all of that. And then continue to communicate the plan, the strategy, and practices in place to reopen in a manner that will keep them safe. Again, that is the biggest thing, is to assure them that you are taking the necessary protocols and putting them in place for them to keep them safe. But keep your messaging simple, and then when they come back into the workplace, make sure, especially in manufacturing environments, larger companies, you've got lots of messaging everywhere. And reinforcing of the new requirements and those types of things. And then again, as always, taking into account, as we've talked a little bit about, the human element, and recognize that, you know, folks are going to be coming back still with fear and stress and anxiety. The levels are higher than probably ever in our history, maybe. So it's just very important to be ready to also kind of provide a holistic approach to our employees also for their well-being. Jay?
Yeah, thanks, Beverly. And just to follow up on the phasing of return to work, that's a one that gives you a lot of options. Like in my world, we're professional office space, so we're allowed to do up to 50%. And we were allowed to May 11th. My business, Jackson Kelly, We didn't come back right away May 11th. We didn't start till this week, yesterday. And as you can probably see from behind me, I'm still at my house. So it's perfectly fine, and I think a good idea. And I think what you'll see is employees, a lot of them prefer to stay at home. But when you do start bringing them back, think about how you phase it. And one of the things that I think is most difficult is don't think of just how it's going to go well, but what are the ramifications if somebody does contract COVID-19? And I've heard some employers coming back in teams or having 2 sets of teams and not switching back and forth. So the same group's always working together. That way, if somebody does get infected and you lose multiple employees because of their contact, you still have a second team that can perform that task. So think about that as you do your phasing back in. The next group, and we won't spend a whole lot of time on this because I think a lot of these are pretty obvious, but the state of Kentucky wants you to put in your plan ways to minimize contact, enforcing social distancing, which we've all heard about, limiting face-to-face interaction, restricting common areas, just some basic principles. The lesser the contact, the safer it is. Some ideas that I've heard mentioned or put in place. Some places that are higher traffic or larger sets of employees have put in one-way hallways. One interesting debate is, what do you do with your doors? I've heard several businesses that are just keeping all doors open, which upside of that is it minimizes contact. You're not touching door handles, you're not pushing on doors. The way my office is set up, we have part of it's that's open to the public where our lobby and conference rooms and mediation center is, and part that's more private for the employees. And those doors usually stay shut. So do we want to keep them shut, which adds more contact, or do we want to leave them open? Right now it's pretty easy because we're not having many customers in. Sorry, there's one of the joys of teleworking, the doorbell. Other ones to talk about: break room. A lot of places are closing down their break room. The communal refrigerator. A lot of places are closing down the refrigerator, saying you can't use it at all. Others are saying minimize use. Microwave is another one. Sometimes that's off limits. I've seen some places with policies that says you can use it, take your food back to your desk, clean the microwave. There's some flexibility on that. The other one that's tough if you're in an office building is what you do with your elevators. To keep, a lot of commercial landlords are putting those in place for you, where it's no more than 2 people on the elevator at a time. But all of those ways to minimize contact, come up with what's best for your business. You've got a little flexibility, but just have a reasoned plan. And I'll let Beverly touch on some of the cleaning and hygiene topics next.
Great, thanks. And so we're going to talk about number 6 and number 8, the hand sanitizer, hand washing and sanitizing. And I know you all probably know, like Jay said, some of this is just things that we've been aware of, that we must do. And so again, making sure you have all of the adequate hand sanitizer, setting up extra hand washing stations. It's interesting because I don't think many of us knew that we would be educating adults on how to properly wash their hands, right? But we know that it's just part of it. So one of the things that's been interesting is, to think about as we educate them at work, it's also maybe even talking about how they can practice these at home, with their circle of family and those types of things, and then reminding them that not just washing their hands once or twice, it's before and after their shift, it's before and after their breaks, it's before and after they go to the restroom. hopefully after they blow their nose into a tissue. Unfortunately, I have a manufacturing client who some of the men use the old-fashioned method of not using a tissue, and they also spit a lot. And so we actually have had to have some conversations and some reminders around no spitting, and to make sure that if you're going to blow your nose, it's not into your sleeve, it's in or onto the ground, it's into a tissue or a paper towel, even if that's, and then discarding that. A lot of people say, oh gosh, I always had allergies, and I might sneeze or something, and then put the tissue back in my pocket, throw the tissues away. So again, some of this basic education that we all take for granted, but let's just remember how important it is to keep reminding all of the people that work for us. Again, wash their hands before and after eating food, before putting on, touching, or removing face coverings, gloves, or other PPE. So important. And then as a new normal routine, again, what you should provide: the tissues, the no-touch trash cans, the disinfectants for surface and skin, disposable towels, and then discouraging workers, again, and think about your environment. I know here we might walk by a desk and pick up someone's pen to make a quick note as we're thinking of something or somebody says something to us. And so just being aware and helping your employees be aware not to share equipment. How many times have we been sitting in a meeting and maybe slid our laptop over to somebody else for them to quickly do something? It's just creating that awareness of, if you do that, certainly discourage it, but if you do it, disinfect, clean the keyboards, any tools that people must share in a manufacturing environment. Certainly think about, do they have to share those tools? Do we invest in more tools? How do we safely disinfect? How do we safely keep those clean when multiple people are touching them? And then as you bring people back to work, and again, I don't know how many of you have brought people back into the workplace, but a lot of companies have been doing a deep clean, and that includes the carpets, the walls, and even bringing in those UV companies to disinfect the whole work environment. I saw trucks for one out the other day called Pure UV, and they do the whole office. Increase the frequency of cleaning and sanitizing. Again, this is not where we just have a cleaning person come in every now and then. This is, what's your schedule? Post it. Check off that you're doing it, just like we see in the restrooms at a fast food place where we go or whatever. You want to make sure that it's being done consistently and properly. And again, it's also teaching your employees what their responsibility is to help maintain that safe workspace. If you have the ability to, like Jay said, they're talking about airflow. So if you have the ability to install high efficiency air filters or increase your ventilation systems, highly encourage it. But overall, just consider your environment and what you need to do to keep your staff safe. And I'm going to turn it back over to Jay to talk about masks and face coverings.
Yeah, and one kind of practical tip, following up on the cleaning and also the minimum contact: ask your staff, ask your employees. As they go through the day, they'll spot things. One I never thought of was our copy room. Our copier has a keypad where you have to put a client code in. That's a high touch area. Do you have to clean it every time? Probably so. Well, one of the best ideas I've heard came from my 8-year-old. He said, "Dad, why don't you just use a stylus like you do for an iPad?" Then everybody uses their own pen or stylus. Use that instead of your finger. If you have keypads, ingress and egress. But ask your staff. That'll involve them in the process. They'll buy into it more. But they're also a lot of times the best resource for how your business really operates and what needs to be taken into account. Next is masks. I think the biggest questions Beverly and I both are receiving have been masks and taking temperatures. So take just a little more time, but we've gotten some good guidance. This is one of the areas where the state's minimum requirements have really helped and have evolved a little on both those topics. Here's the language from the state on masks. It's kind of 4 big takeaways without reading it to you. 1, masks are required in your workplace in all common areas. Wherever you're going to be coming into contact with someone else, your employees need to have a mask on. The mask can be a cloth mask. A surgical or N95 mask is not required. The next one is one that's evolved a little. When the minimum requirements first came out, they said it was not required in enclosed spaces. And several of us immediately thought, how is that going to be interpreted? It's, for my office, it's pretty easy. I've got a door to my office. When I go in and close the door, I'm in an enclosed space. A lot of places, that's not the environment. Gray construction. It's all open concept. Some of the tech companies, the co-working spaces, it's just not designed with enclosed spaces. So what does that mean? Well, they've updated it so you also do not have to wear a mask if you're working alone in an area with more than 6 feet of social distancing. So as long as you're staying 6 feet away, if you're working by yourself in one of those type areas, you can take your mask off or lower it. But your employees need to put it back on whenever they get up and travel in the hallways or the common areas. The other question we get a lot is, can I require visitors or customers to wear masks? And the guidance is very clear. Yes, you can. And you can decline business for visitors who are not wearing masks and complying with your request. So those are the big takeaways for masks. I think we have talking about the temperature and health screenings next, which is another of the big topics that hits a lot of people.
Yes, and I know we have a question on this, so I'll address this hopefully as we go through this. So again, as you can see here, we are required to complete a temperature and health screen. And that can be either self-administered or administered by the employer. So screening techniques may include the use of a written questionnaire, and that can be returned in person daily, via email, text. Of course, there are some apps out there. The state of Kentucky uses an app. There are several that are out there. And then, of course, you may use no-touch thermometers, digital thermometers, and the digital no-touch systems that you can walk up to that will assess your temperature and that type of thing. The employee self-reporting, and then visually inspecting employees for signs of illness or symptoms. So whatever screening technique you use, it's important that you clearly put this in writing to your employees and outline the specific screening method and process that you will utilize, as well as the general benchmarks for passing the screenings. And that's where you want to rely on the CDC list of questions that I think, Deanna, might be on the next page, possibly, or it might be in the document below. But your expectations around your employees' compliance, yeah. So
sorry about that.
It's on that next, yeah. Thank you. That's okay. And then again, you'll want to explain to your employees the expectations around their compliance with your process and any consequences for a refusal to participate. And I think that was the question I saw in chat. What can you do? Well, of course, the first thing you want to do is have a conversation with them about, why we're doing this, et cetera, that, again, try to see what their fear is or what their hesitation is. If they're just refusing, there have been some instances where people have said it's against my constitutional right, or you're not allowed. I don't want you knowing my temperature, or just these types of things. It simply then becomes a matter of their ability to come to work. And if they're not willing to do it, you may not have a choice but to terminate them. It is just that important because you are required to do this. You are required. They are either required to self-monitor and attest that they do not have those symptoms and that their fever is not over 100.4 and they haven't been around these types of people, etc., or allow you to do it so that you can determine that they're not bringing that into your workforce. And again, yes.
I had an additional question to that.
Okay.
Ask prior to the webinar if you could provide further guidance on the self-administered health and temperature checks and any practical auditing measures? And maybe you're going to get there, but
Yes.
I thought since we're
Yeah.
talking about it right now, I'd go ahead and bring that up.
Yeah. No, thank you so much. And so assuring them of how you're going to protect their employee privacy and their information. And then again, circling back to the consequences of an unsuccessful screen. Should they, have a fever more than, or should they answer the questions in a manner that you would have to send them home and advise them to seek medical care immediately, hopefully within the next 36 hours. So if you're using the self-reporting questionnaires, again, you're only seeking the information as it's outlined here in the form of yes and no questions, and it must be completed prior to the start of each shift. I heard someone talking about, and I don't remember where I heard this, but they even have put some guidance together to remind their folks not to take their temperature the minute they step out of the shower in the morning before coming to work, not to take it after they've gone for their run, those types of things. So there is no real specific guidance around that fine level of a detail, but if you start hearing some of those questions, obviously you would want them to be, not overly exerted or those types of things when they self-monitor at home. So the CDC does provide extensive guidance how best for employers to also achieve physical distancing if you're going to conduct them. So not only for the person being assessed, the person assessing them, and the people waiting to be assessed if you decide to conduct them on site. Again, I would highly recommend that you follow their guidance, which includes using the touchless thermometers if at all possible. That is not required, it is just highly preferred. You can set up, and there's some guidance on how you would set up a temperature taking session, even if it's with one that goes under the tongue and has the protective covers and those types of things. But really, some sort of digital or the no touch is really what's preferred. It's important that you use the same type of equipment for all employees. So don't mix the types of thermometers you're using. Try to keep that consistent so that the results are consistent. Disinfecting the equipment following each employee screen. Replacing any of the test taker's PPE that might come into contact with the person who is being assessed. Incorporating other controls, and I think it talks about it in some of this guidance, erecting physical barriers or partition controls where appropriate. And then again, if you're conducting these on site, it's conducting that visual inspection for signs of illness or symptoms. Interestingly, the Healthy at Work requirements do not require, and the DOL has agreed so far that, one, employers are not required to provide thermometers for the self-reporting. Neither are employers required to compensate non-exempt employees for the time they spend taking their temperature before coming to work because it's considered de minimis. Keeping a log of temperatures is not required, nor is keeping those forms. What I would say, and it ties into the question I think before, is the importance of keeping that information, whether it's in the app form or again the questionnaire that you design, that the employee physically answers all of those questions and signs and dates it and turns it in every day. That is the best way to be able to collect the information. Now, as far as auditing the information that someone gives to you, I'm not sure, Jay may be able to speak to it a little bit better than myself, but I haven't seen much around what else you could do to audit the information they're giving to you. I think we're making a good faith effort to collect the information. We've outlined how they need to answer the questions appropriately and submit that to us for us to allow them to enter the workplace. So and again, I'll let Jay address that here in a second. But the most important thing, again, is just maintaining that information just as you would any other medical information with, complete confidentiality and keeping it filed where you should, those types of things. Employees, especially the ones who are involved in test taking, but just your employees in general, should be trained not to discuss names of individuals who may have tested positive or who may have symptoms or those types of things. It's going to be really hard in large organizations. We're already hearing at some that well, this, so-and-so got sent home, they didn't let so-and-so in, he's out in the parking lot, just, those types of things. But you really want to discourage gossip and that chatter, but especially trying to keep their identity confidential is very important. And even, thinking about how you will discipline employees if they should violate some of that confidentiality. Again, the bottom line is if they have a fever or they're displaying these symptoms or answer those questions, you just cannot let them into the workplace. And as Jay said, this guidance and these regulations are continuing to change at the local, state, and federal level. So making sure you keep up to date on what's going on with this and that you are still in compliance is critically important. Jay, you want to jump in?
Yeah, I think on the auditing, I think the main thing is to have a record that it's being done. If there's any way to automate it, whether it's if you have employees that clock in an automated system, if your provider can add, some kind of check where they check that they've filled out the form, anything you can add that just documents that your assessments are being done. So if you do get audited by an agency later, you can show that. And the more process oriented it is, some places don't have much of an option other than email Jay every day that you filled out your form. Now that's pretty dangerous because one, you're relying on everybody to do it, and you're relying on Jay to follow up and make sure he got them all, and if he didn't, to go back. So you could see where a policy like that could be pretty dangerous. Sometimes it's your only option. But the more you can automate it, make it part of your systems and processes, the better. With regard to following up to kind of test the accuracy of a self-assessment, I would caution against that unless there is something, blatantly obvious, or if you get a report, if one of your employees says, hey, Beverly just told me she lied on her form just because she has to come to work, then that's something you probably need to investigate. But otherwise, I would not pry into what individual readings were. You don't want to be asking about family members. You want to follow those questions. They're carefully worded. Going quickly through a couple of the other requirements, the notification and testing plan. These are going to be ones you're largely going to rely on your public health officials for if you do have a positive. The biggest thing you're going to want to focus on with your plan internally is the confidentiality. You certainly don't want spreading the word that one of your employees had a temperature. Now, if somebody tests positive for COVID-19, you need to have a plan in place that notifies those they've been in contact with. Obviously, we're all hearing a lot more about contact tracing. If that happens, I would come back to the guidelines as they're in place and follow the lead of your public health officials as we get more staff to do the contract tracing. If you're following their lead, you're going to be pretty safe on what you did for your own workforce. Accommodations, number 11 in the minimum requirements, which is on the next slide, is the government has required that you have, and these slides here are some of the additional guidance you'll want to read in the minimum requirements that I'll leave everybody to on their own. But accommodations, you need to be aware that some people may need accommodations, with masks. One of the exceptions is if it's somebody has a health reason not to wear a mask, you should make an accommodation for them. You can also make accommodations for, age or pregnancy. You can always give people more rights, whether it's allowing them to work from home longer, additional leave, creating a little different workplace for you. You can give them more rights. What you want to be careful of in doing accommodations is not assuming an accommodation for somebody. This is particularly dangerous With age and pregnancy, age is probably the easiest example. I mean, we've all heard over and over again, higher risk is age 65 and over. So very well intentioned, you might come up with a return to work policy that is all my 65-year-olds and older are staying home for their own safety. Well, that's age discrimination. You can't tell them that they can't come to work. You can give them that option. So you need to be able to make accommodations and be careful of pitfalls in discriminating when you do so. And then we'll wrap up. We just have a few minutes. I want Beverly to talk a little bit about training and implementation, and then I'll wrap up with final comment on making sure you follow through with what your policy is.
Jay, before
Thank you, Jay.
Sorry, Beverly. On the accommodation, should employers have a ADA form completed, or would this even fall under that with the situation we're in? If someone's like, if they can't wear a mask because of age or an illness or even a mental illness, maybe anxiety or something along those lines, should they be getting an ADA form filled out? Maybe that's a Beverly question. I'm not sure who that would go to.
I actually haven't looked at on the ADA form specifically. One of the resources we'll send out, and the EEOC has put out some frequently asked questions that is heavily ADA. I've been looking at them for some other things, and a lot of them are ADA. That very well might be in there. That'll be on your resource. You certainly want to document it, assess it. If you have any questions, go back and study it. I think usually you'll be able to tell whether it's a legitimate request or not just by its nature. But that might be one I can look up and get back with everybody on.
Yeah, I agree. So just quickly, number 12 and 13, again, we're back to this Healthy at Work officer. And again, just reminding everyone that this is not an option. You must have this person identified. Now, we have not been required, all of our businesses have not been required to submit our plan or to submit any of this information to the state. Some other states, I think Indiana, most businesses had to submit a plan for reopening, if I think. Just be prepared. If you should be asked for this, you better know who this person is, and you better have this person trained. So it's our advice that you follow this, because the person in this role is so critical. They're going to be developing, enforcing, adapting, and continuing to revise your procedures, your policies, the processes for screening, testing, and notifications. And like Jay said, yes, your public entity, the health department, typically is going to take the lead on this, but then there's some work for you to do once you have someone that's tested positive. And having a person in charge of this will make your life very, very much easier, I think. And then they'll oversee the proper monitoring and maintaining of the employees daily by collecting and maintaining the information in a confidential manner. And then ensuring that employees are cleared to return to work. Should they have symptoms and have to be quarantined, should they test positive, whatever the scenario is, this person will need to be able to work through that process and be able to bring that employee back, as soon as we can, but then not any sooner than we should. So the Healthy at Work officer also should train all employees on the requirements and expectations of a compliant Healthy at Work workplace. A lot of my companies have just put together a 4 or 5 page PowerPoint, run through the minimum requirements and the plan that they have put in place and what the expectations are. And then this person also, as Jay has said, should stay abreast of guidance from, the governor, the state of Kentucky, the CDC, the DOL, the EEO, ADA, and even the mayor. Honestly, I haven't had a chance to look at the mayor's plan for Fayette County. That's on my list to do tonight to make sure that there's nothing that we're not aware of for Kentucky or that we're modeled after that, but even being aware of what's happening in your local town. So I'll turn it back over to Jay.
Yeah, and then we've talked a lot about what goes into your plan and coming up with it, but probably the number one scariest thing for me as an attorney advising my clients is the implementation and follow through. Once you have the plan, you have to enforce it. You have to make sure your employees are following it. Otherwise, if something happens, it's an absolute nightmare. And when you get into any kind of litigation, you've got this wonderful plan that all of a sudden turns into the roadmap for the plaintiff's attorney. They're walking through all these things that you said were important to do and asking you if you did them. And if you hadn't, you're going to look silly and you're going to be at great risk. So it's important in developing your plan to make sure it's one you can follow, but then it's also important that you actually follow it. It's important that you adapt. You're going to have to, the government's been changing almost on a daily basis. You're going to have to too. But when you do, update your plan. Make sure those changes make it into your written document so it's consistent with what you're doing. Enforce it and then lead by example. If you're requiring your employees to wear masks, which you have to, but the company CEO or top level management just kind of does it when they want to, that's another recipe for disaster if you ever end up in litigation. It's not hard for a seasoned attorney to walk the CEO through, 5 or 6 questions of, you care about your employees, don't you? And when you put this plan, you wanted to make sure they were safe, and safety and health of your employees above everything else, including making money. And you only did this to protect them, and you didn't even follow it yourself, did you? I mean, you can all see how easy it would be to make that come back to bite you. So once you have your plan in place, follow it, update it, educate continually, and lead by example.
Thank you so much, Jay and Beverly. I think we've answered most of the questions. There was another question that we got beforehand, but it is not related to reopening. It's about emergency paid leave. So we can circle back with that person on our end. If anyone else has any questions, I think we're right at the, we're right at 3 o'clock. So thank you both. Appreciate you. And we will be sending out the list of resources that Jay mentioned throughout the presentation today to those that have attended. And I hope everyone has a great afternoon. Thank you.
Thank you. Bye.
Thanks, everyone.